Her Opinion Show, the podcast you didn't know you needed. Real talk, bold truth, her voice, her vision, her rules. Let's get into it. It's another fabulous week here at Her Opinion Show. And today we have a special guest with us, and it's Dr. Tonie Reincke, whichever way you say it.
All the above.
You better know who she is. But yeah, we just talked about that. Last name sometimes can be mispronounced, but we are familiar with who you are, and we wanted to share all the good things that you do, because one of the things that women love to know is how they can, not, I wouldn't say perfect, but look a little better. Mm-hmm. And you do something for the ladies that's special, and it's helping them with veins. So,
not so that they could be vain, but but
no pun intended.
Yeah,
exactly.
Maybe if that's the case.
Yeah.
But we all struggle. We all have these struggles. So tell us a little bit about exactly what you do and how you can help women with these problems.
I think the first thing and the most important thing.
And announce your facility.
Oh,
yeah.
Okay. So I am the medical director and owner of Reincke Vein Center. Mm-hmm. My own. I'm the sole provider there. And the thing that I can do for women, I think the most important thing that I do for anybody is empower them through education. So it's important to just understand what is vein disease, which is what I treat, and then give them options that they can decide what's best for them.
Mm-hmm. And I think a lot of times they didn't know it's a disease. They just think, just mentioning that, I mean, I really just thought it was like, oh, I got a whole bunch of veins on my legs.
Right. Yeah. So what I teach people is, for me, I'm the expert. I'm gonna let you know, hey, does this bother you? And the most important part of that is not just how it looks, but do you have symptoms? So do you have tired, heavy, aching legs, swelling, that kind of thing? Or is it just for you? Is it purely just how it looks? And either one of those things, yes, I can treat, but if you do have some symptoms associated with it, I want to educate you, right? And then you can make a decision. What's best for you?
Do they eventually, like, for instance, I'm not shy, I have a lot of veins. Will they eventually cause a problem? Or sometimes some people, it would never cause a problem?
If you have underlying vein disease and it's not treated, right? So these big stretched out veins underneath your skin and you can't see them, typically slowly with time, yes, you'll start to develop symptoms. But there are some patients who will say, no, they'll come in and they'll have a lot of veins, skin discoloration, et cetera, and they'll tell me, I don't have any symptoms. And it's possible that a patient can have really advanced disease but not have symptoms just because they've developed a tolerance to it. So I wouldn't say that they'd never have issues. I think that they just develop a tolerance where that becomes their norm, right? They've been taking care of the kids for all these years, taking care of the family, and forgotten kind of to take care of themselves. And all of a sudden they wake up and they're like, yeah, my legs actually do hurt. Or they don't even recognize they do because it's become something, it's become their norm.
Right. So we'll get into that deeper.
Okay.
I do want to get to know you personally because you were on Glow Time with Jackie, which is another one of our podcasters under her media network. And I know y'all dove deep into that. Mm-hmm. But I also would like to know who Tonie is behind the doctor. So how did you get to this? What's your, feel free to share whatever you'd like to. If you don't, that's fine. But just what your journey along before that, kind of give us a background on how you got here.
So I guess what I would start by saying is that I am the first child in my family to go to college. My mother did not graduate from high school. My dad didn't go to college. And I really didn't even know until a counselor came up to me my junior year of high school and said, you're in the top 10% of your class. Have you thought about going to college? Because I didn't really have the courses I needed to get into college. So I needed to go get some math. And I went and I did that at a university. And that's really the first time that I thought about even going into medicine. And I didn't start out thinking, I'm going to be a doctor. I started out just taking baby steps. And for me, that was, I went to nursing school first.
Okay.
Yep.
And was it here in Houston or?
No, I was in Indiana. So the largest nursing school in the nation, at least at the time, was Indiana University. And I was there. I went to nursing school. I got out. I was a surgical ICU nurse. And I did that for 7 years. And then I took my next step, which was I became a physician assistant, and I worked in brain and spine surgery, paying my way through. Just kind of each time would sort of give me, I guess maybe what I needed, a little confidence, because I definitely was not confident. There was no reason, really, to be honest. There was lots of cycles of things that got broken with me, and so I developed that with each diploma, with each level of education, so nurse to PA, I developed confidence. Didn't have any mentors or anything.
I guess trying to find also your passion, like
yes.
what type, because there's medicine has a variety.
Correct.
Trying to find what do you really love.
Yes.
And also, like you said, breaking generations of things,
yes.
traumas, whatever
yeah.
we have as women and that we come from. Gaining that confidence to believe in yourself, to say, I can do this. You have to be your own motivator, your own cheerleader. And that's hard. That's hard for a lot of women. Some women never gain their confidence.
I know.
And they go through life through that. And it's like, it's just sad to see that there's not somebody that hasn't crossed their path to like believe in them and say, you know, the things that you might have had to do alone.
Yeah. In fact, just as I digress just for a second, I had a patient yesterday who shared with me, she divulged with me that she had recently, she found her husband was having an affair. She's devastated. She was crying in the office yesterday. And I was able to relate to her in the fact that it wasn't that long ago, several years ago, where it was brought to my attention that somebody that I was in a relationship and had no idea was also dating multiple other people and married. So the whole relationship was a sham.
Wow.
Yeah. And
you kind of feel, you know, and because I've experienced it too, like, how did I not see that? You know, like
yes.
I'm educated, you know, like I'm
Exactly.
smart. Like I'm
Exactly.
smart enough
Yes.
to have noticed, but we did.
yes, we're very smart. It's not about being smart
Yeah.
or not. Just speaking on that, there were red flags, but I didn't think the red flags were to that level, obviously.
Yeah.
Or I don't know, maybe not. But so sharing with my patient, even that, you know, like you said, I'm an educated woman. I have 3 degrees. How could I not see that? But all I can say is, you know, I raised my hand. I participated in it. Even I knew it wasn't good. How about that?
Yeah.
I knew it wasn't a good relationship, but I kept having hope. Like, oh, maybe if I just, or it's probably because this or that. There were plenty of red flags. So for whatever part I played in that, yes. But I still had to get confidence.
And for us as women, we do that very often. We don't want the shame of getting a divorce or breaking up or starting all over again.
Yeah.
We put this whole, you know, all these things in our head that like, what are people going to think? All these things that we don't think about. Well, what if the other side of this is something waiting for me, bigger and better?
Yeah.
And I don't have time to worry about all of that.
No.
And you're just prolonging it.
I
Right.
agree. Yeah. By sticking in that toxicity or that less than ideal type of a situation.
Exactly. And I feel like with all of us with different cultures coming from different backgrounds, we've been taught to keep that quiet, not to talk about it, to possibly not run into somebody who else is going through it or went through it and says, hey, you don't have to stay.
I know.
Like, that's the biggest thing I think is we hold on to. Don't tell your family business. Keep that locked up and deal with it on your own. Well, you don't. It comes out in the worst ways that you can think of. So we thank you for sharing that, because this is what our show's about. We like to get a little bit intimate and personal, because someone might be watching out there that doesn't have somebody.
I know.
Yeah. And listen, and for anybody out there, celebrities get cheated on too.
Oh, yeah.
So if a celebrity can get cheated on,
I know you're like,
beautiful
there's
people,
like,
beautiful
yes,
people, right?
I know.
Yes. So
I mean, and there's a rainbow at the end of the tunnel. Like, life has something for every single person. Sometimes we just can't get over the moment but the other side is always so much brighter,
Yeah.
you know?
And
Learning.
I'm just saying, no, it's just crazy how sometimes it also affects, your business. What's going on personally affects your business. You're not able to use your full potential in what you're doing because you're thinking about all of these other things. And so once you're able to have confidence, break that and say, hey, I'm going to move on, you feel like a little bit more free.
I definitely, that is how I experienced it. Yes. I was spending so much time and energy, not that and I don't know, but I will say I didn't feel like my business was ever suffering. But I definitely recently kind of leveled up. And I'm so happy I did. I mean, I had that confidence to do that. I said, it's not about seeing more patients. It was just a different way of getting outreach and education out, a little bit through socials for sure. But that was a piece that I felt like now I have the time and the energy, and I'm very confident that I can do it.
One of the things I will say, because I've been single for a long time, and my first relationship was toxic. I was young and didn't know any better. But now, excuse me, that I'm older, wiser, mature, I realize that some of the best accomplishments that I've had done were being single.
Yeah.
Because we pour so much into the other person, making sure this is that we take away from our personal. And I think that, again, being to what we're taught when we're younger is that the next step is finding your person, getting married, when it should be finding yourself first, right? And
yes.
I mean, you're a better relationship when two people know what they want, are already there, and then come together and say, how can we make this better?
Yes. Amen.
Right?
Yeah. Twins.
Yeah. So with all that being said, then somehow, well, that was how long ago, by the way?
When I found out about that relationship.
Or when you actually broke up?
Yeah. That was 2021. I was sent a letter in the mail.
So did y'all meet before or after you became a doctor?
After.
After. Okay.
Yes. All the harem of women with that individual were all like professional, very successful women. But yes, I was sent a letter by one of the ladies, and I have a lot of respect for that. Met her, kind of went over that, the whole thing together. But I
mean, that must have been
so much.
Hard
so
for her.
shocking. Yeah, so shocking.
Right? I have a ton of respect for that. I really do.
And it was a letter,
Well, I met her.
to-
She gave me her number.
Was this the one he was married to? Oh, wow.
No. Yeah.
Wow. It's crazy, right? That somebody can do something.
Yes.
I mean, to this nature, it's actually not so much like, because you can't say, what the hell was wrong with me? Because it is that easy for something like that to happen. But you have to more so look at the person and be like, what the hell is wrong with you?
Exactly.
How did you even have the time
Yes.
to do these things?
And not get confused, texting the wrong person. And
right, you know.
Well, this just turned into a whole different show.
I know. Sort of about legs. Yeah, everything that he was denying or saying, like, for instance, how would I have time for that? I wasn't even asking either, right? But how would I have time for that? I've only got time for you. Like, I'm super high maintenance, although whatever. I mean, that's just a way
The narcissist
it
side.
is an excuse,
the manipulation of making you think,
Oh, yeah.
oh, you're crazy.
Oh, yeah.
Yeah.
Don't worry about it.
But actually, that's exactly what he was doing.
Oh, yeah.
It's like juggling all these women and yeah.
Probably on one of those texts, you're just like, why did he send me that? And it was probably somebody else.
He's just hungry. He just has an appetite. No,
of course,
but,
since then, of course, since then, it's been all groveling, and I can't tell you how many numbers I've had to block and get authorities involved, and I'm just like anybody else. I'm a woman, and I just happen to be a doctor, but
And we
I'm
go
not
through it.
Yeah, and I'm not. I certainly never try. I would never think like, oh, I'm above that. No, I just didn't expect it.
Yeah.
And personally, we know that you're not above that. But I think some people think, oh, your life must be so perfect.
Oh my gosh.
And
nobody's life is perfect.
No, you know. Or sometimes some people think, oh, you have more money, so it's easier.
Yeah.
Do I though? I mean, don't get me started about how many I am very good with living below my means, and it is something that
most people who are hard workers, they don't live, above their means. They'll live below their means because they know how hard it took.
Well, we had a plastic surgeon here, and she broke that down. She was like, and I shop at bargain shopping.
Oh my gosh.
Right?
Right. I had a few little things, but in general now, my sons, if they hear this, would be laughing, because you look at my closet, and basically my closet is scrubs.
That's
all different colors.
That's
Scrubs and surgical clogs.
Yes.
Yeah.
Well, listen, all of that is what makes you human, obviously, because we can relate more and be like, oh, you're just like one of us. I mean, it's crazy to say that, but it is what it is. And, taking you back to why you're here in the profession you do, that can affect a woman. When you go through these traumas and you go through these issues, do you feel like that can be a reason why you have these issues too, with like veins and circulation, just because you're going through traumas?
I don't think it helps in this sense that you may be ignoring symptoms that you have, because your whole focus is on sort of mentally just getting through, getting by, and you're ignoring symptoms. I don't think it causes it. The number one cause of vein disease, or what I treat, is genetic. But then you add on other things. I guess if you looped it like this, you aren't taking care of yourself, you gain weight, you become depressed. That all could be a huge snowball effect into not taking care of yourself.
Right.
So maybe...
And not noticing. Not noticing.
Exactly.
Everything else comes first. Everything else comes first, and one day you look in the mirror and you're like, what is this?
I know.
Yeah, but
it's been there.
Yeah.
But it's been
for
there.
years.
Yeah.
Everybody else noticed it. You did.
I know.
But that leads to circulation problems, right? So one of the things is that I always remember is that my mom would always complain about her circulation and stuff like that. And not that she has so much of visible bad looking veins. They're there. But what if you don't really see them, but you have horrible circulation?
Good. Okay. In fact, I let family practice, or not let, but I'm lucky enough to have family practice residents that rotate with me. I had one this morning, and we were talking to him about that. Had a patient on the table. I was going to do a procedure and just explain to him, if you look at her legs visibly, you see nothing. They look great, but her legs really hurt her. She had symptoms. That's why I'm treating her in the first place. So not everybody, but most people that have issues with their legs have visible veins. You can have a little bit deeper issue going on, backward blood flow, poor circulation, meaning the blood's going the wrong way, without having to have visible symptoms. Yes, it's possible.
So it's possible.
It's possible.
So basically, if you feel pain or you have circulation problems, then definitely get it checked out.
Yeah.
And it's not only women.
No.
Pretty sure men.
I love you for saying that. I mean, no, it's not just... Actually, it's 60% female and 40% men. So there's a lot of men that have it, but they tend to present later, push it off, blow it off, and say, oh, no, it's just cosmetic, and it's not. And then when they present, they have advanced disease, meaning skin changes, open wounds, bleeding veins, prior wounds that didn't heal, that kind of thing. Yeah, so men tend to present a little bit later.
Do you feel like just men don't care as much?
I don't think that's true. I don't think it's about them caring or not. I think it's really multifactorial. It could be socioeconomic. So maybe for some a little bit older patients, it's the man was the breadwinner. He's got to have a job. He's out there. Everybody's depending on him. That kind of a thing, or that they've assumed, again, that it's just a female disease, and it's no big deal.
Or they just don't know, and they don't think
That's
that,
right.
Yeah, I feel like people don't really understand
They
the
don't.
things that go on with your veins.
No, I have a young guy right now. He's maybe like in his mid-30s, being treated, huge veins, really advanced disease, and what he said to me was, I can't tell you how many years I've been talking to my doctor about these big bulging veins. And he said, there's nothing anybody can do about those. This is a guy like in his mid-30s. He's got 3 kids, a wife or a girlfriend.
I really hate
etc.
doctors like that. I'm sorry.
Oh my
to say.
gosh! I was like, I feel so bad for you, but I'm gonna take care of you.
Yeah.
Yeah, and I think that's just something to send out, is to always see a specialist. If you have, like, you feel like, I mean, don't just stay with that one person's.
Or get a second opinion or whatever.
Or, you know, ask to see a specialist, definitely, someone who knows about that thing. But, I mean, I guess, like I would say, I would just look at my veins and say, oh, I don't like that, but not know what could be the symptoms of it. You know what I'm saying? So that would be definitely, I'd have to go see you, a specialist who would be like, have you been feeling this? Yes, I have. Like, no wonder my foot's going numb.
Right?
My foot goes numb every Friday. But, you know, for things like that, we just don't really think about it. And like you said, we've got other things going on. And so it's so important to stop and focus on yourself, or things that you keep overlooking. So if you could suggest anything out there to anybody, male or female, what would you say would be things to look out for?
Symptom-wise, probably the number one or the most common thing that multiple things can cause it, but patients will sort of not address it, is swelling. You know, swelling in your legs, it's not normal. So it could be caused from many things: food, dietary, exercise, change in weight, could be other organ systems, meaning the heart or the kidneys. But it also could be caused from backward blood flow, inflammation, swelling, right? Another thing that I would tell people, at least with my center, and it's 100% true, is you can come in, I'll see you for 15 minutes, do a free evaluation, look over your history and your paperwork, and teach you. I'll just teach you. Doesn't mean you're not obligated to get treated. And if I don't really think you're a good candidate, I'm not going to treat you. So it's free. I mean,
and I love that.
Nothing better than that.
No, free 99. Okay, free 99.
Yes.
So one of the questions I would have before we wrap this up, we're running out of time, and before, I mean, just to let you know, we will be going to your office and doing some personal.
They're gonna see how many veins I have.
Personal recording to show what she really does.
Dang.
But if I had a blood clot or something in my legs, would you be able to tell?
Yes.
Okay, that's good, valuable information.
How would I do it?
Yeah.
History, physical exam, and then if I felt it was indicated, we do ultrasound. So we can do that in the office. The nice thing that we teach people, and we just told the family practice resident this today, is you don't have to wait. Meaning if you call ahead or you don't, and you stop into our office, we can do the ultrasound that day. You're going to have the results before you leave. And then I would call, if you were a patient, I would call your family practice doctor and say, hey, I saw Nushin today. She was worried about a blood clot. Yes or no? Just wanted to let you know.
And what would be a symptom that maybe we're missing?
A blood clot? Pain and swelling in your calf, usually, okay, that's getting worse. Despite ice, Motrin, maybe an ACE wrap, compression hose, and it's a sudden onset. Maybe you woke up with it and, oh my gosh, my calf is big, red and swollen, and I just went on a long plane ride. That's the perfect setup.
Okay, got it.
Well, just to end completely, no, I'm kidding. Can you give some advice to a woman? Because I know that you transitioned from being a doctor to an entrepreneur, having your own business.
Yes.
Anybody that's out there that probably went through what you were going through, any kind of advice that you can give them?
I would say maybe the thing that I wish I had known is you can do it, and you can do it solo. You definitely have to put things in place. So for me, it was just being methodical. I knew my practice. I knew my subspecialty. Having those pieces, but there's no best time or good time. Just take the leap. And I did. Yeah.
I love that. That's great advice, I think, for all of us, because you can do it alone.
Oh, yes, you
can raise a child alone. There's so many things you can do. I think we'll have you back for a whole different topic.
I'm happy to.
Yes, but thanks for being here.
Thank you so
much.
Thank
Can't wait to go to your office and see more of what you do up close and personal. But until next time, guys, we'll see y'all. Bye.